If you're at risk of snake bites, this is the best video for you as we explore the first aid techniques of what to do when bitten by a snake. But first, let me briefly take you through some symptoms of snake bites. Let's jump into it. Signs or symptoms of a snake bite are not always visible. In some cases, a person may not even feel a snake biting them. Symptoms may not be obvious for an hour or more after being bitten. It is important to act quickly if you suspect someone has had a snake bite. Depending on the type of snake, signs and symptoms may include immediate or delayed pain at the bite site, swelling, bruising or local bleeding, bite marks usually on a limb that may vary from obvious puncture wounds to scratches that may be almost invisible, swollen and tender glands in the groin or armpit of the bitten limb, faintness, dizziness, nausea and vomiting. Other symptoms are headache, abdominal pain, oozing of blood from the bite site or gums, double or blurred vision, drooping eyelids, difficulty in speaking or swallowing, limb weakness or paralysis, difficulty in breathing, and sometimes initial collapse or confusion followed by partial or complete recovery. You have to note that not all snakes are poisonous or venomous, but you should still follow basic first aid techniques just in case. To save someone after a snake bite, simply follow these steps. First action is to call for help or an ambulance. As you wait for help, lie the person down, ask them to keep still and reassure them. If the bite is on a limb, remove any jewelry on the limb if you are able to do so. Try to mark the location of the bite site on the skin with a pen or photograph the site and apply a broad pressure bandage or clean cloth over the site. Mark the site where the bite is on the bandage with an X. Again, apply a further elasticized roller bandage, starting just above the fingers or toes and moving upwards on the bitten limb as far as can be reached. Make sure the bandage is as firm as possible to the limb, so you are unable to easily slide a finger between the bandage and the skin. Then immobilize or restrict the bandaged limb using a splint and keep the person lying down and completely still. Continue to check the color, temperature and feeling in their fingers or toes. As you follow the steps, have it in mind the time of the bite and when the bandage was applied. Do not wash venom off the skin or clothes because it may assist identification. Continue to stay with the person until medical aid arrives. But if no medical aid is coming, organize a means to transport the person to the immediate health facility. Don't make the person walk to the rescue vehicle, rather bring the vehicle as close to them as you can. Always remember, first aid techniques should be done as quick as possible. Thank you for watching, and subscribe or follow the channel for more videos like this.